Surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and this is where we talk about musculoskeletal pain, which is basically orthopedic pain. And you can call and join the conversation at 866-870-5752 here in the studio. That's 866-870-5752. Okay, Dr. Darrow.
We're talking to Eric, who's got a knee issue. You still with us, Eric?
Yeah, I am. Thank you.
Thanks for holding.
Yeah, thanks for waiting. So I want to, before we get right back to you, Eric, I want to just talk about what the show is about. It's about healing orthopedic pain. That's muscles, tendons, ligaments, joints, with regenerative medicine, meaning instead of cutting tissue out, which the surgeons do, it's a process of growing tissue back and regenerating and rejuvenating the area. So I was just talking when you were cut off a little bit before about my own knee, and I injected my meniscal tear on my right knee, which I saw under my ultrasound. The ultrasound is not the kind that heats the body up, but the kind that looks inside the body, and it's like a camera that goes inside. So when it first hurt, I took a look, and my meniscus was pretty beat up. It was torn up, and I injected it a few times, and it looks pretty darn good now. So I can run now, I can play golf, I can do all kinds of things that I couldn't when it was torn. So I'm not saying every knee that I inject, tears go away, but the idea is to get rid of the pain and increase the range of motion. So with your meniscal tear, I'm pretty sure, just based on my experience of doing this work over 20 years, that we can make your knee a little better, if not all better. It may not look better if you get an MRI, but that's not really what people care about. They don't care about their MRI. They care about their function. And some people who are very analytical say, but I want it to look brand new. And I can never promise that for anybody. I can't really promise anything with anybody. I don't think doctors should be promising things. But you get the idea. And if you would look now, and if you come in the office, I'll be glad to show you your meniscus under ultrasound and see if there's any fluid in the knee. We can do that in a second. And I can show you my meniscus on both sides and how they have improved. So what else do you have to tell us, Eric?
Okay. Thank you for your call, Eric. And we understand you finished. You felt complete.
Let's go to Nancy.
Let's go
with her
to Nancy
sister's
in
ankle.
Inglewood. Okay.
Hey, Nancy, Dr. Marc Darrow, how are you?
Hello, doctor. I'm calling on behalf of my sister, Peggy. She has a problem with her ankle. She broke it, I guess maybe a year or two ago. But since then, she has not been able to, the bone that the doctor put back together somehow on an x-ray that we saw, part of her bone is no longer attached to the joint in her heel or in the ankle. And I was wondering if would the stem cells, is it possible for bone to be rejuvenated in that aspect?
You know, it's a good question. Bone can be rejuvenated by stem cells. That's been shown. But she may not it may not be a bone problem, because I'll tell you what happens. When people fracture a bone, the bones usually heal, but the soft tissue around it doesn't necessarily heal. that's a case where I would have to touch the area with my own fingers and see what's going on and see if it's really a bone issue and see if the bone is healed. I assume she's had an x-ray sometime recently that has shown that the bone has actually healed, but it might be the soft tissue that's causing the pain. So does that make sense to you?
And actually, there is no pain involved. It's just that she hasn't been able to walk, and she's been in assisted living for a year. And
okay. How old is she?
She's 68. And because of that, there's been, I think, there's also a wound on the side of her heel from the issue as well. I think if it's not the bone, then there's something going on, because when she broke the ankle, the doctor did a great job and everything, but after they took the cast off, when she was laying down, I guess to prop herself up, she would continue to use her heels to move up on the bed, and the wound opened again. So she's been having quite a few problems, and she is diabetic, by the way. So that's
okay. Well, there's the issue. I was just going to ask you about that. The fact that you said she's in assisted living was a hint that there's more going on than what you initially said. So that's more complex. She may consider getting hyperbaric oxygen treatments. Okay? And that can heal the wound. That's the first thing. That wound has got to get healed. And if she's overweight, that's going to be causing her diabetes. Is she type 2 diabetic?
You mean taking insulin?
Yeah, does she take insulin?
Yeah.
Okay, so she may be a type 1 or just a very advanced type 2. Is she overweight?
Now she is, because of being in the bed. But I will look into the hyperbaric oxygen? Yes. They can either do it, it's possible to do it right near her bedside by bagging the leg, but a chamber would be the very best way to do it. She would be taken to a hyperbaric chamber. I will look into that. I appreciate it. And, let's talk about the reality here. The reality is, being a diabetic and having a wound is one step towards an amputation. So she has got to clear up her diabetes. If she's overweight, she's got to stop the carbs, and she's got to get that wound taken care of. Okay? Yes. They really don't do a good job where she's at, so I think she only has the wound care person come. They used to come every day. Now it's once a week. Okay. And all they do is bandage it and clean it. Yeah, that's not going to help. That's not going to help. No, it isn't. All right. Thank you. Feel free to call me anytime you like, or email me. You can get to my emails through the website at www.lastemcells.com, or you can call the office 800-300-9300. There's not a lot personally that I would do with her, but I can give you some backup help on directing her. That would be wonderful. Hyperbaric oxygen might save her life. Oh, thank you. I will call the office and get that. I don't think they have anything available for her that way, but I can look into it. Thank you. Okay. God bless you. Thanks for your call, Nancy. Thank you very much. Good luck with your sister. Now. Bye-bye. Our number is 866-870-5752 here in the studio. You can call now. Lines are open for you to speak with Dr. Darrow. And that website again is www.lastemcells.com. That's www.lastemcells.com. We're here Saturdays at 10 a.m., again at 1 p.m. And remember, when you phone the program today, you get a free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. Nita, you usually talk about how many studies are in the book. There are 264 studies in the book, actually, scientific studies. And the foreword is written by Suzanne Summers. And there is something in the book on hair growth if you're having that kind of issue.
That's
hair
really
growth
the
and
only
vampire facelift.
Right.
Yes, there are two ancillary treatments we do with platelets or stem cells, and they can make you prettier. And my work is more about function in the musculoskeletal system, but my wife does the other treatments. So if you want to look better or grow some hair, give us a call. The office number is 800-300-9300. You can call anytime. If we're on the lines, you can leave your phone number. We'll get right back to you. Time for another question for me?
Actually, I think we're going to just in a half sec go to Carol and Irvine. Here
All
we
right,
go.
let's do that then. Hey, Carol, Dr. Marc Darrow, how are you?
Hi. I have a left hand that's shaked for about 2 years. Initially, it's intermittent, and at first it was just a little, and now it's a bit. I have a brother with Parkinson's, so I finally made a neurological appointment, and the information I got was she stuck some needles in, and she said back in the base of my neck, she mentioned C7, C8.
Yeah.
There are some issues, and she started saying surgery. And at the end of the appointment, I said, I believe in integrative medicine and alternatives. What's available? And I sensed her demeanor changed. It's like I'm a surgeon. I do surgeons. I do surgeries here, there, and at UCI Medical. And I said that's great. And now I've heard. I had the MRI done, and I've heard absolutely nothing. I was put on hold when I called the office, so I need to pursue that more. Yeah. The other piece of information is I've lost 2 inches of height. I'm 64 years old, and I just know as a teenager, as a young person, I used to be 5'8", and I always put that. I just assumed I was a 5'8" person. Recently, I measured. I'm 5'6". So I thought it was a calcium issue, but now from something you said earlier in the call, where you talk about drying out of some of the cushioning material in your spine, like just a minor compression in each of the discs. Where'd those 2 inches go and when?
How old did you say you are? 21?
Yeah. I'm 64 and otherwise healthy.
Well, there's a Beatles song about you.
That's right.
My birthday was this month. Yes. Will they still feed me? Will they still feed me?
Yep. So let me respond to a few of these things. You have a hand tremor. Is that correct?
An intermittent hand tremor, left hand, and the neurologist said, no, it doesn't look like Parkinson's. Unlike my brother, if you can hold it still, it doesn't reappear on the other axis of the body, which it did for him.
Okay. So there's a couple things. Number one, if I were you, I would get to an integrative doctor. What area do you live in?
Irvine.
Okay.
California.
So I don't know guys down there, but I know guys up in the West LA area, which is inundated with alternative practitioners. If you want to get more direct information from me, go to my website, www.lastemcells.com, and just email me, and I'll help you out finding what you need. So it sounds like you may have had an EMG or a nerve conduction study to find out if you have a radiculopathy causing the tremor. Usually people don't get tremors from that, but they usually just have paresthesias, which means that you feel funny things, pain or numbness or tingling. But if you want to just get a hold of me through the website, then I will feed you more information specific to this.
So
there are IV... Go ahead. Tell me what you're saying.
So I'm not exactly a candidate for like prolotherapy in these discs or that disc cushioning material.
You might be, but if you're not having pain, I'm not going to just jump right into that.
I don't have pain. There's no pain.
Yeah. So there is a doctor who specializes, he's a neurologist in Florida, and I'm blocking his name right now. Here it is, Perlmutter. Dr. Perlmutter, and I'm trying to think of his first name. I can't.
David
David is the name. Thank you.
You're welcome.
And he's written books about this, about Parkinson's and other neurological issues. And I would look him up on the internet because he uses high-dose antioxidants IV to get rid of these neurological issues, okay? And I've seen videos of his with patients with advanced Parkinson's that could barely move. He does an IV, and then they are so happy they're dancing up and down the hallways, and their face loosens up and they can talk again. So I'm not telling you that what he does is real because I wasn't there. I'm just telling you what I saw. And I've read some of his books, and I like what he has to say. And I'm an alternative type guy too, meaning I like things done conservatively, and surgery is not conservative. We had a person call the show about a year ago whose husband died from a neck surgery. He came out of the surgery on a ventilator, and I haven't talked to her recently, but I stayed in touch with her for quite a while, and I think I will go give her a call today and see what's going on in her life. She was a very, very strong woman, thank goodness, and got through it okay, but
I remember
it was
her.
terrible.
Yeah.
Yeah.
And doctor, you helped me indirectly. I had a meniscus tear from a sport I shouldn't have been doing, and having heard your take the surgery out of pain, I went to one doctor. My knee was swollen, kind of locked up. I was limping, and they said, "Oh, we could do surgery. Your medial meniscus is torn." And
Yep.
I rested and iced it, and then came back with a gal in my church worked with me on exercises, and I'm happy to report I didn't do the surgery. And the thing that made me cautious was they called me 4 times after I said I didn't want the surgery, saying things like, "We have an opening on Tuesday. Can I schedule you?" And I said, I told you I want to delay. I want to wait and try other things. "We have an opening on Thursday." And just the pushing the surgery made me draw back. And I heard your show, and I'm like, I'm on the right track. But icing, alternative, and I'll tell you, as recently as yesterday, I did a double stair climbing in a building, which I do twice a week so that when I meet up with my kids, I can still hike in the hills and stay with them. And so I can still run stairs, 64 years old, on that knee, and it's back and no pain. And I didn't do the surgery, and I probably
we get that's amazing. But we hear that all the time on the radio show, and I hear it all the time in the office. People call up or they come in the office and they say, "I was getting pushed to have a surgery on whatever it is, and I didn't do it, and I'm fine now." So, I'm not blaming the surgeons because I was in that track for a while in my training. I wanted to be an orthopedic surgeon. And then after a bad surgery on my shoulder, I decided that wasn't going to be the way, and I healed my shoulder by injecting myself. So I don't think it's a statement against the surgeons because I think they're great people and they have the hardest work in medicine. It's just a culture that needs to change, and it is changing now with people like you and me coming forth and saying, I had to have a surgery, but I didn't do it, and I'm fine. So with Google and the internet and everything else and seeing all the failed surgeries, people are getting smart and not doing them as much, but it's still the culture of surgery, I'm sorry to say, and thank goodness it's starting to change. I've been pushing ever since medical school not to be doing these surgeries, and I've had a lot of mad surgeons. They don't like me. So, they say my work can't possibly help. Well, it's been helping tons of people over many, many years. And I often have patients go back to their surgeon after they're healed and tell them. And the surgeon says, that couldn't have helped. It just healed on its own.
Wow. We call that denial in my business.
I hear it all the time.
One other situation.
Go for it.
My son, U.S. Marine Corps, broke a disc lower back and one of those internal bones on the ankle. And the VA is my impression, big on pills. So the question, 90-day supply, lots of addictive things. My son does not like to take pills. And for healing, you mentioned previously today hyperbaric chamber for healing. Well, it was healing a wound. Would that increase oxygen? Would that help with bone healing?
Yeah. The real healer in the body is oxygen.
Right.
We can do all kinds of things. My work helps bring, blood, stem cells to the area that brings oxygen there. It's really oxygen that does the healing. There are things that stimulate tissue to grow, which is cool also, but you need the oxygen there. And a lot of these areas that don't heal with people are, like the ligaments, the tendons, the cartilage, because there's no oxygen. There's no blood supply to bring the oxygen. Oxygen is carried on red blood cells.
Okay, so that's with a broken whatever disc lower back.
I don't know the answer if it's going to, but it's certainly a way to try.
And it wouldn't hurt.
Well, I don't think so it's everybody, but somebody could get it. Anytime you walk into a doctor's office, you can have a bad result.
Right.
We have to be cautious.
So the challenge then is any recommendations on how to find a hyperbaric chamber? Just go to his area.
Yeah, it depends on, you can Google it. I mean, I know of a couple in my neighborhood, but that's far away from you. They're all over.
Okay.
They're used. They're used, at hospitals for wound healing and for strokes and things like that. So they're available.
But
they're around.
They limit it to several items and will not do it for general, health and healing.
No, it won't be paid for by people that have things like fibromyalgia that people say it works great for, or things of that nature, chronic fatigue.
Burns and
okay. But it's worth paying for it if it works.
Exactly. He's a young man and very and he's a Christian and a great kid. Very patriotic. We got to get him healed.
Why don't you have him email me, and I'll start a dialogue with him and see if I can help him out. Just have him go to www.lastemcells.com. Every page on that site has a place to email me. Or he can just call the office to get more info. It's 800-300-9300.
Thank you, Doctor.
Thanks
Lovely
so much
talking
for your call,
to you, Carol. God bless you.
Thank you. Let's go to John in North Hollywood.
Hey, John, Dr. Marc Darrow. You say you have a hopeless knee. What does that mean?
Well, I don't know if it's hopeless or not. Anyhow, I've been taking, I guess it's a product called Relief Factor, and it helps a little bit. But
good.
Different days, different things happen. And I was scheduled for surgery, and I backed out. Out because I just don't want any. I've listened to you for a long time. And I have one question.
Oh, I'm so sorry, John. Please call us back next week or go to the website. Thank you, Alex. Thank you, Suzette. Thank you, Dr. Darrow, and everyone who listened and participated. And remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. and thanks for joining us today.